the World Organization for Animal Health, WOAH, announced on Monday the detection of a rare avian influenza outbreak on a California duck farm, marking the first instance of H5N9 in poultry within the United States. This discovery occurred concurrently with the detection of the more prevalent H5N1 strain on the same farm, located in Merced County, California. The devastating consequences of the outbreak resulted in the culling of nearly 1 hun. The sheer scale of the avian influenza outbreak underscores the urgent need for comprehensive surveillance and rapid response measures to prevent further spread and potential human health implications. The WOAH statement acknowledges the uncertainty surrounding the potential for H5N9 to infect humans and trigger a pandemic. While the immediate public health risk is currently assessed as low, the organization emphasizes the critical need for a thorough risk assessment to determine the virus's potential for transmission to humans. This assessment is crucial given the novel nature of the H5N9 reassortment virus and the potential for unpredictable evolutionary pathways. The inherent unpredictability of viral evolution necessitates proactive measures to mitigate potential risks. The discovery of H5N9 in poultry alongside the already established H5N1 infection raises concerns about the potential for further viral reassortment and the emergence of novel strains with enhanced transmissibility and pathogenicity. The co-occurrence of these two distinct strains within the same environment creates an ideal setting for genetic exchange, highlighting the complexity of managing avian influenza outbreaks and the need for a WOAH. This underscores the intricate interplay between avian and mammalian influenza viruses and the potential for unexpected evolutionary trajectories. A study published last year in the academic journal *Emerging Microbes and Infections* provided compelling evidence for the role of cats in the transmission dynamics of avian influenza viruses, particularly H5N1. The research highlighted unique mutations within cat-borne H5N1 genomes, suggesting potential adaptations that could facilitate transmission to other species. The study's findings indicate that cats may act as mixing vessels for the reassortment of avian and mammalian influenza viruses, facilitating genetic exchange and creating the potential for novel, highly transmissible strains. The cat's role as a potential bridge species in influenza transmission significantly expands the complexity of the epidemiological landscape and necessitates a wider scope in epidemiological surveillance efforts. This discovery necessitates a reassessment of surveillance protocols and preparedness strategies. The presence of both H5N1 and the newly discovered H5N9 strain within the same poultry population underscores the need for enhanced biosecurity measures on farms, including improved hygiene protocols, stringent movement controls, and early detection systems. These measures are crucial to preventing further outbreaks and limiting the potential for viral spread. The U.S. Centers for Disease Control, CDC, has acknowledged the situation, stating that while the current public health risk is considered low, the agency is closely monitoring the evolving situation and collaborating with state health authorities to track individuals who have had contact with affected animals. This proactive surveillance approach allows for early detection of any potential human infections and enables a swift response to any emerging public health. The collaborative effort between the CDC and state agencies ensures a coordinated and effective response to potential human infections, safeguarding public health. The ongoing surveillance and monitoring are crucial for maintaining preparedness and mitigating the risk of a potential human pandemic. The situation highlights the ever-present threat posed by avian influenza viruses and the dynamic nature of viral evolution. Continuous research, advanced surveillance systems, and swift response mechanisms are crucial for managing these outbreaks and preventing potential pandemic threats. The importance of international collaboration and information sharing among health organizations cannot be overstated. This collaborative approach is essential for effective global response and mitigation strategies to address the evolving challenges posed by avian influenza viruses. The unpredictable nature of viral evolution necessitates continuous vigilance and adaptation in surveillance and control efforts. The future preparedness against such outbreaks requires continued investment in research, improved surveillance technologies, and enhanced international cooperation. Only through a collective, proactive approach can the global community effectively address the potential risks posed by avian influenza and safeguard public health worldwide.